I'm Sheryl Hack. I'm 17 years old and I'm living with myasthenia gravis. I was diagnosed with myasthenia at 16 years old in October. I started having symptoms of having really bad weakness in my legs and arms and hands, and I'd noticed that my eyes started drooping and stuff, and it wasn't that bad, but then it started to get worse over time and stuff, and the more I was doing. And then while I was at school, I noticed that my muscles in my mouth and stuff weren't working right, and that when I was trying to eat or drink, that it was really hard to chew foods, and that the fluid in my mouth would just kind of fall out and my mouth wouldn't stay closed, so I would have to hold it closed. And then when I told my mom, she of course got really concerned and took me to the doctor, and they didn't really know what was going on. But then my eyes started bothering me more, and I went to an eye specialist, and I went when my eyes were really droopy, and he said that I needed to be tested for myasthenia gravis, that's what he thought it was. And he did a little test while I was in the office where he took some ice and put it on my eye, and for some reason the ice with myasthenia gravis, if the muscle's weak, if you put ice, it brings the eyelid up, and it did, and he said that's more than likely what it was, and I got tested for it at the hospital, and my levels were so high that they said that was for sure what was going on. Myasthenia gravis is a muscle disease. It happens, it's with your voluntary muscles. It can affect your eyes, your mouth, your arms, your legs, fingers, your neck, and if it gets to the point where it starts affecting your breathing or your swallowing, you need to go into the hospital because you just don't want to have those kind of problems. What causes the weakness is if you use your muscles up too much. It's kind of like a battery. If you use a normal person's battery, they can use it up and they can charge it fine, and it'll go back to normal. Well, a person with myasthenia gravis, their battery starts to drain, and then they can't really get it up by themselves, and so sometimes you need to go into the hospital and get IVIG or plasmapheresis. IVIG helps boost your immune system and stuff, and then you can either do that, which sometimes the doctors won't prefer you to do that because it works really, really well. Afterwards, you feel like a new person, but it doesn't last for as long. Plasmapheresis is when you go in and they have to surgically put a catheter in you, and The surgery isn't painful. I was scared at first. I was scared that it would hurt, but it didn't hurt. It was just a little uncomfortable, but they are good about keeping you on meds to help you feel comfortable. And then, so plasmapheresis is when they bring in these big machines. They look ancient, but they're really good, and they pretty much take your blood out of the catheter and they put it through the machine, and it cleans out all the bad antibodies. And then there's new antibodies that they took from blood that's been donated and other good nutritions and stuff that they put back into your body, and then they give you while they put it into your blood back into you. Plasmapheresis works best for me, but it's different. Some people have IVIG that works best for them, but plasmapheresis works best for me because it works a lot longer for me. Myasthenia has had a big effect on my life because it's not always easy to do some of the things that you were able to do before, but I've learned how to kind of pick up on some of the things that I used to do, just make them kind of shorter. Like, I used to play softball, and I had to give up softball because it was just not good for me. It was wearing out my muscles too much. But now I have where I like to go to the batting cage and like spend just a few minutes and then take a break, so I can still have that part of me of what I love to do. Myasthenia has had a big effect with school also because I've missed a lot. I was actually having to be on homebound for about 3 months because it just is when I first got diagnosed, and I was just way too weak and was out of the hospital. So it just made it easier if I wasn't in school to be getting taken in and out of school. So I slowly worked up onto getting better, and then my doctors cleared me saying I could go back to school. So I went back to school and started back on my new routine, which really helped me with coping with myasthenia too, to still make me feel like, I'm still normal. The problems I had with school and my myasthenia is sometimes I realized that you have to explain what the disease is to several people, because sometimes it is noticeable that you have something wrong with you. Because sometimes your eyelids, they get really droopy. Sometimes your mouth, when you're like smiling, you don't look like you're smiling. Or when you're laughing, it might look like you're crying. So, the best thing to do is just tell people. That's what I do, and try to tell them in the easiest way because they don't understand. But most people are really good about accepting and stuff. So it's not easy being a teenager or a kid living with something that you have to just stop what you're doing because of like a muscle disease holding you back. And this is pictures of my bunny Hercules. And he's just been really good for me because just being able to take care of something else other than me all the time is just makes me just makes it a lot easier. And just having something to love on you and you be able to love back, it just helps with your stress and anxiety and stuff. If you're having anxiety attacks, to kind of just play with them or something and it goes away. Yeah. When I'm in the hospital, it's never a problem with me having to communicate with my friends. I'm either on Facebook, Instagram, Twitter, all the social media sites. And then also if I want to see them, we can always Skype or FaceTime or something. That way I can keep them up to date and they can make sure that I'm okay and give me words of encouragement and stuff like that. Having myasthenia hasn't taken away normal life for me. I'm still able to do just as much as anybody else can, just with some limits. I like to go fishing sometimes. I like to go to like the park with my family and stuff and just chill out in the sun and stuff, but you have to be careful and wear like sunglasses so your eyes don't get weak from the sun. I like to ride four-wheelers. Even though I can't play softball, I still like to go and cheer on my team because even though I can't play, I'm still a part of the team. And I like to take my little sister on walks and stuff, short walks, not long walks, because sometimes if you're out walking a lot, it wears your muscles. I go on vacations still, even though you have to pack up all your medications and make sure you're still managing your disease while you're still having fun. You can't let it get the best of you. And I use humor to make fun of my disease. I know that's kind of silly, but I've noticed that a lot of people do. Like, here's me and Grumpy Cat. I call him MG Cat because his eyes are droopy like mine. And just stuff like that. These are pictures of my doctors that I had painted. Here's one of them.
That's great.
And then here's another one of her. I don't dislike this doctor. I just was having some fun. She knows that I don't not like her. This is my Dr. Puri. He's the neurologist. He deals with the myasthenia. And then this is one of his. This isn't actually him, but it looks exactly like one of the doctors that is with the neurology team, so we printed that off and painted it. Actually, my nurse painted that one. She had too much fun with that. People that are just like you, that are out there and that are willing to talk to you. I'm on Facebook. You can talk to me. There's websites on Facebook of people that have really become a family that all have MG, and they're able to talk to each other and express their feelings and have others with MG that are just like them to talk to. And I want you to know that you are not alone and that you should never give up hope and give up what you believe in and never change yourself because of a disease. But you do have to change some of the things that you do, but don't change yourself.